Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. So this afternoon we'll be discussing about lung cancer, no? So as you might not know, no, lung cancer is probably the third most common cause of cancer, no? Right after breast and colon cancer. So problem with lung cancer is the diagnosis. Okay, so most people who are diagnosed with cancer or lung cancer in particular, usually it's in their late stages. Okay, the reason for this is because, of course, a lot of patients or people who have lung cancer usually don't feel anything, especially if their tumor is still small. No, so the only time that they do feel anything, let's say like cough, sometimes they cough with a bit of blood, sometimes they cough and then they have loss of weight. By the time they have these kinds of symptoms, sometimes it's already a bit too late. The tumor has actually grown to a big size. So it's really important to screen for, not just, cancer, but every year if you're able to do your yearly checkup just to see if your heart, your organs, your liver, your kidneys are doing fine. So one of the screening tests, the easiest is, a chest x-ray, just to see how your lungs, your heart looks, no? So, because, a lot of people, we do see a lot of patients with lung cancer who are already, and, sadly, no, nasa late stages na, no? The reason for this is, again, late diagnosis because of, they really don't feel anything, no? Which is sad because, especially for patients with stage 3, stage 4 lung cancer, the survival rate is really not so good as compared to the other solid tumor cancers like breast or colon. No? So lung cancer is really a bit more difficult to treat. No? One of the things that's really becoming a problem with patients with lung cancer is history of smoking. Okay, so we're now seeing more patients with lung cancer, yet they don't have history of smoking, or they don't even have history of secondhand smoke. So sometimes the wife would complain, my husband is smoking. So these are what we call secondhand smoking. But, more and more patients now are actually being diagnosed with lung cancer, even though they don't have real exposure to smoking. So with this, I think it's really in the environment, not just smoking. So now, one of the things that we really have to consider is, pollution, especially the air that we breathe. They have, sometimes it's high in what we call heavy metals, right? So you have lead, you have mercury, you have cadmium. So people who are exposed to a lot of these chemicals, these pollutants, are also more likely not to only develop lung cancer but also chronic lung diseases. So it's really a bit concerning. So we really have to make sure that we have to be in a cleaner environment. So if, let's say, you are to be able to live in cleaner environment, so we have to make sure that we need to protect ourselves, especially our body and our immune system. So I would always say to people, if you really want to prevent not just cancer but all types of diseases, take your vitamin C's, take your vitamin D, make sure you have lots of green leafy vegetables just to protect yourself from all these pollution. Also, we make sure that our food that we're eating is as unprocessed and doesn't really have too much insecticides or pesticides. I think we really have to understand that the air that we breathe, the food that we eat, the water that we drink really affects not only our health but also our environment. Okay. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes. MJ asking, what if it's metastasis to the lungs? If it's a metastasis to the lungs, again, it's really hard to treat. Usually, if you have metastasis, your oncologist would suggest more chemotherapy. So it's hard to to digest that sometimes, right? So, but what's important when we have, hopefully, if you do catch lung cancer in its early stages, it's a very good prognosis. Only those who have been diagnosed late, it's really harder to treat. There are now what we call immunotherapy drugs available. They're not even IV, they're oral. They're actually effective against several types of non-small cell lung carcinoma. Those they just have to be tested for certain markers to see if they are qualified to take that oral immunotherapy drug. Okay, the only issue with immunotherapy drugs is again the cost. Okay, usually they would cost over 100,000 pesos in a month, so that's really a big issue. Another issue with this oral immunotherapy drugs is the prevalence of resistance. Okay, so usually patients on these oral immunotherapy drugs will respond to that drug for, let's say, 3 to 6 months. After that, they become resistant. So then there's a problem what to do next. So usually when they failed an immunotherapy drug, oral immunotherapy, they have either switch to another immunotherapy drug or they have to do IV chemotherapy, which is harder on the body, aside from having a poorer outcome. Okay, so but hopefully in the future there will be a better immunotherapy drug wherein it will have less drug resistance. But aside from taking immunotherapy, there are also natural remedies against that has been shown to have an favorable effect against lung cancer. So these are your green tea extracts or ECGC. Also, there's what we call quercetin. You find quercetin in your onions, your garlic. Okay. There are also other supplements that may help. These are your curcumin or your turmeric. So these are just some of the supplements that may actually help you if you are diagnosed with lung cancer. Okay, so even though it's harder to treat, it's still possible. It's just that we have to boost our immune system for our body to be able to actually handle or try to get rid of the tumor. Okay. Also, those who are diagnosed with lung cancer, one of the issues also, especially with the newly diagnosed with lung cancer, it's similarities. Some of them, not all. Okay. Some would have similarities to pulmonary tuberculosis. Okay, so I have had several patients now wherein they were initially diagnosed with lung cancer. Good thing, we had it rechecked because, they do look similar on X-ray or on CT scan. So when they did biopsy, it showed like there are, neoplastic cells. But then again, when you check them for tuberculosis, okay, and then they're found out to have, okay, you're positive for tuberculosis. So we treated, the patient for tuberculosis, and successfully we saw that the tumor has actually disappeared. So it's actually not a tumor, it's actually tuberculosis. So it happens. So sometimes in some patients, tuberculosis will appear as cancer. So we have to be mindful of this. Okay, so I think that's one of the things that we see, especially in patients who, never lost weight, just a bit of cough, in fact, they even start gaining weight. So you think, is this the right diagnosis? So then we check for tuberculosis, PTB, just to make sure that we cover all the bases. And some patients are very lucky, that it's not cancer, but it's actually tuberculosis, which is very, very easy to treat if we do it properly. Now I will read some questions from our listeners and answer them in this segment.